it just came up around the same time we've just started doing this. We're working with some of the. A pastor called me and asked that exact question.
Okay.
You know, and when I started listing all the tests available, he said that no, the church wanted to pay, and he said what's the bare minimum. So we'll talk about the bare minimum. And what I like about some of these progressive churches and progressive individuals, that they're getting tested before they get married, so that they have an idea of what kind of babies they're going to have. And just it's a way of reducing birth defects and a way of reducing child mortality or morbidity meaning child sickness or newborn sickness. And we should support all those efforts. When you talk about men, for men, you want to make sure that they can reproduce, that they have enough sperm. That's one of the most important things. And it's hard to say just what test do I do. You have to take into account the person's age and any other what we call comorbidities, any other health problems they may have. So the test I order for a 25-year-old healthy male will be a little bit different than what I would order for a 55-year-old man that has high blood pressure. Once we get above 40, we start testing the prostate as well as looking at sperm test. But before testing, the most important thing is to sit down and take a good history.
Okay.
Most important thing is take a good history. Sit down and talk to. I'm not afraid to ask, have you ever gotten pregnant before?
Okay.
What happened to those pregnancies? And you ask the man and woman that question. And if they're honest, you can get a lot of insight into what problems they may have going through at the time, or what problems they may potentially have. So for men, sperm, and then for women are complicated. They have a lot of hormones, so when we look at their hormones, but I'll ask questions about how regular period is, how heavy periods are. Has she ever gotten pregnant before? A lot of those will now kind of guide me on what tests I'm going to order afterwards.
All right, 7 minutes.
That's a decision. When you say stay, that's a decision that the man and woman should have discussion. I don't know if you remember. I think we did a topic one time, child spacing.
Okay.
And when we have to define, number one, what is infertility? Okay. Infertility is difficulty in getting pregnant over 1 year, and with adequate exposure. Adequate exposure meaning they're meeting three times a week for 1 year. Then we start to worry that these people, so there may be some infertility in this couple. Okay. And after that, then we now talk about family planning. And a lot of people think family is exactly what it says. Planning out your family. What's your maximum family size? And then we can now talk about child spacing. And child spacing is how much time do we take in between our children. And there's a space between getting married and that first child, which is the question you're asking. And a lot of that has to do with, in this environment, I see a lot of family pressures that come about. But a lot of that should really do, financially, emotionally, where are you as a couple, and are you ready for that first child? When you've been trying for some time and you're now having difficulty, then you now come and seek medical advice.
All right.
But that difference between infertility, family planning, and child spacing is very, very important.
Okay, so talking about infertility and spacing and all, is there advice for newly
consultation? And get a consultation. Try and do that. And when I say consultation, that's an interview by a doctor, And when I say that, you try and do it as a couple if you can. A lot of times I'll get the woman, and the difference in cultures here. I'll get the woman asking questions and coming to do her tests, and then sometimes we may find it very difficult to get the man in the office. And at that time, it's important to make people realize that infertility is not a woman's problem. It's a joint problem. It's equal percentages of women. If it, when we look at infertility, you say 40% of the time it's the woman's fault, 40% of the time it's the man's fault, and 20% of the time both individuals have an issue. And but a lot of times I see, most of the time that men feel like, oh, they don't have any problem. It must be with the woman. That's one stereotype I see. And another one I see is people pay a lot more attention to infection. They just think everything is infection. And doc, just give me some drugs and
to just clear it up.
yes, and everything will just go away. And it's a lot, and getting pregnant and fertility is a lot more complicated than that, and you'll end up just going round and round in circles unless you do it properly the first time.
All right. So, how does regular period?
If in the history I hear that a woman is having irregular periods, meaning periods that are not, coming every 28 days, lasting 3 to 5 days, it gives you an idea that maybe this person has a hormonal imbalance. Okay. And when I said women are complicated, they have, up to 5 different hormones that regulate not only menstruation, but also ovulation. And it's important to know that ovulation and menstruation are not the same thing.
Okay.
A lot of what I do on this topic in the office is education, and making sure that women know that just because you menstruate doesn't mean that you can get pregnant. It doesn't mean that you're ovulating. Ovulation means eggs are leaving the ovaries and making their way down into the uterus or the womb. And there's so many things that can block that. Hormonal imbalance is one of them. Another one, physically, your tubes can be blocked.
Okay.
If your tubes are blocked, you'll still menstruate every month, but eggs will never make it to where they're supposed to be, and this person will be infertile. Meanwhile, I get a lot of reports that, oh, I'm seeing mucus, I'm seeing blood regularly. Why am I not getting pregnant? And then we have to explain that there's a lot more to it than that. So understanding of the process is extremely important.
All right. Yeah.
That's Juliet, right?
Yes.
Yeah. So Juliet knows us by now. I can't give you names of drugs on the air, but I can talk in generalities. And when you're talking about drugs to reduce fat, most of the time there are 2 categories. One of them are drugs that increase your metabolism. They basically just make your body work harder all the time, and that helps burn calories and also burn fat. And then the other type of medications block fat digestion. Those ones, both of them come with side effects. So I don't recommend anybody start those kind of medications without being examined properly by a physician. And meeting a friend that's a chemist or a friend that's a doctor at a party is not what I mean by properly examination.
Okay.
I get that a lot too. Oh no, I called a friend and he recommended I go. You don't want to start drugs that have these kind of side effects under those conditions. You really need to come and have an exam. The first class of drugs that increase your metabolism, the side effects can be heart attack, can be stroke, because they increase your metabolism, they increase your blood pressure, they increase so many different things. So you need to be monitored to make sure that you didn't already have high blood pressure or already have a sickness that this will just make worse. And the fat blockers, you can have a lot of bloating and indigestion and diarrhea and gas with them. So you have to be educated before you go on them. And if I were to advise Juliet, I would ask her to try something we discussed earlier, which was the type of diet. We call it intermittent fasting. And try a diet plan rather than going to medication that has so many side effects first. And do that for 6 months and see what happens.
How your body can adjust.
Exactly.
All right. Phone lines are officially open.